What is the difference between psychogenic Parkinsonism and Parkinson's disease? Have you ever wondered how psychogenic Parkinsonism differs from Parkinson's disease? Both conditions can cause similar symptoms, but they have very different underlying causes and treatment approaches. Let's explore these differences in detail. Parkinson's disease is a progressive neurodegenerative disorder. It primarily occurs due to the loss of dopamine-producing nerve cells in the brain. This loss leads to a deficiency of dopamine, which is crucial for controlling movement. As a result, individuals with Parkinson's disease often experience motor symptoms like resting tremor, bradykinesia, which is slowness of movement, rigidity, and postural instability. Over time, these symptoms typically worsen, requiring ongoing medical management. Diagnosis is based on clinical criteria, where doctors look for at least two primary motor symptoms. Patients often respond well to dopaminergic medications like levodopa, which helps alleviate symptoms. On the other hand, psychogenic Parkinsonism is also known as functional or psychogenic movement disorder. Unlike Parkinson's disease, it is not caused by neurodegeneration or a deficiency of dopamine. Instead, it is classified as a functional neurological disorder. This means that the abnormal movements or postures arise without any identifiable structural brain lesion. While the symptoms may mimic those of Parkinson's disease, they often have distinct features. For instance, the symptoms can be variable and may not follow the typical progression seen in Parkinson's disease. Psychogenic Parkinsonism is often linked to psychological factors rather than a primary neurological disease process. Key differences between the two conditions include their causes. Parkinson's disease is due to the progressive degeneration of dopamine-producing neurons, while psychogenic Parkinsonism stems from functional neurological disturbances. In terms of progression, Parkinson's disease worsens over time, whereas psychogenic Parkinsonism is generally non-progressive and may fluctuate or improve with psychological intervention. When it comes to medication response, patients with Parkinson's disease usually see improvement with dopaminergic therapies. In contrast, individuals with psychogenic Parkinsonism do not consistently respond to these medications. The characteristics of symptoms also differ. Parkinson's disease symptoms are consistent and follow known patterns, while psychogenic symptoms can be inconsistent and sometimes do not align with typical Parkinson's features. Diagnosing these conditions requires different approaches. Parkinson's disease diagnosis involves clinical criteria and may be supported by imaging or treatment response. In contrast, psychogenic Parkinsonism is diagnosed by excluding organic causes and identifying features suggestive of a functional movement disorder. Understanding these differences is vital for accurate diagnosis and effective management. Psychogenic Parkinsonism often requires a multidisciplinary approach, incorporating both neurology and mental health care to address psychological factors. Meanwhile, managing Parkinson's disease focuses on symptomatic treatment and supportive care for a progressive condition. Both conditions highlight the complexity of movement disorders and the need for thorough clinical evaluation. If you or someone you know is experiencing symptoms, it is essential to consult a healthcare professional for personalized advice and treatment options.